okay, common joint affected. So if you sort of think about it, if arthritis, the definition of arthritis is inflammation of the joints, any joint can be affected. Any joint. All the way down to your fingers, all the way down to your neck, any joint. Okay, but I'm just talking about the common joints affected. Okay, so for the front upper body, we're talking about the shoulders and elbows. So if an animal has got front leg lameness, minus all the silly things like a dew claw or claw infection or rib claw or stone, stone in the pad, minus all those, two of the most common reasons for forelimb lameness will be shoulders or elbows. Okay, and for hind limb lameness will be hips and stifle. So same again, minus silly things like cuts on the hocks or cuts or broken claw or infected foot or something like that. Usually joints wise is the hips and stifles. Okay, and sort of metacarpi is the equivalent of our fingers. Metatarsi is the equivalent of our toes. So it's just digits. So those little joints in between can certainly get arthritis as well. Okay, so fundamentally any joint can get arthritis. Okay, and there are sort of few different sort of arthritis. So some of them is just spontaneously happen because of age. A lot of factors affecting arthritis would be things like genetics as well. So how some dogs are more prone to arthritis than other dogs, and I firmly believe that there is certainly a genetic factor to that. And other things is like immune system. So you may have heard of immune-mediated arthritis, whereby the immune system attacks the joint itself. So those are all a lot of different forms of arthritis. So all those are all arthritis. So it's not just your classic 13-year-old lab moving quite slowly is arthritis. So don't be surprised if you hear your friend or somebody else saying, my 4-year-old dog has got arthritis. Interesting. Possibly it's another form of arthritis, like immune-mediated or something else. Yep. So just to give you a rough idea of what we look at X-rays. So like I said, this is not meant to for you guys to diagnose anything, but it's just meant to give you an idea of what we look for in X-rays. So in future, when your vets show you that, you may have a better understanding of what you're looking at, so to speak. Okay. So looking at a shoulder joint, what we are always looking for is nice, clean joints. Okay. So for X-rays, just to orientate some of you guys who have not really not used to seeing X-rays, air is black, bone is white, everything else is grey in between. Okay, so the bones, you're looking at the smooth sort of structure around there. And in contrast, if you can take a look at all these extra bony formations, all this extra bone, all the fluffiness of it, it's no longer as straight and nice and clear cut. So we are looking at all this fluffiness. So fluffiness basically is talking about new bone formation. Bone is a very, very interesting organ, because bone is also considered as organ. Okay, it is constantly remodeling. Some bones will disappear, some bones will appear again. Okay, and how arthritis forms is that when there is new bone formation, what it's actually indicating is that that joint isn't rotating as well as it could. That's why there's new bone formation. The problem with new bone formation is that the new bone itself causes a joint to be even more sore, because now you're actually knocking bone on bone, so to speak. So that's why you're looking for the fluffiness around there. Okay, and so for elbows, if you look at this elbow, it's nice and clean. You can see a nice circle. Everything is all very, very nice. Compared to another elbow like this, you can see the fluffiness up there and behind there. So you compare those two elbows together, you can sort of see the difference between. So that's what we're looking for. We're expecting nice, clean angles. But if you get fluffiness, that's not good. That is signs of sort of what we call osteophytes, new bone growth, or signs of arthritis. Okay, hips and stifles. So stifles is another word for knees. Okay, so for sort of hip. Okay, so you can see the hip is what we call a ball and socket joint. Okay, so if you imagine a ball and a socket, and that is where the sort of the hip. That's why our hip, we can rotate in all different angles compared to an elbow, whereby it's just a hinge joint. You can only go in one angle, one plane, whereas the hips you can go a little bit in more different directions. And how they gauge is that the better the conformation of, the more of the ball being in the socket, the better it is. Okay, so what you want is a fairly tight socket, whereby a lot of the head is actually in the bone itself. Okay, if it doesn't have good formation is what we call hip dysplasia. Hip dysplasia is basically another word for saying it is born like that without a good formation. Okay, so what happens with that is that you may get a very shallow socket. Okay, or you may get a very flattened ball, okay, or a normal ball but a shallow socket. What it means by a shallow socket is that instead of going like this, shallow socket allows it to go like this because it's a shallow socket. Okay, there's more movement than what is restricted for a nice and tight ball. Okay, the problem with more movement is, as I mentioned before, once you have bone rubbing on bone, then you stimulate new bone growth. So now you have a very painful joint because you have new bone growth going and the joint is moving, having a range of motion much more than what it's supposed to be. Okay, and as you can see from this socket over here, so this is a quite nice ball fitting in the socket, whereas this, you can see the shallow socket is much more shallow, and you see the flattening of the femoral head. It's because it was nice and round before, but because it starts moving like this, it starts grinding down your roundness to make it flatter. So in the end, what happens is that you get a very, very flat head with a very, very shallow socket, and that can be quite painful. And that's what we're talking about, okay, with hip dysplasia. So this is what we call nice, excellent hips. You can see the nice congruency of the socket sitting right smack inside there. And more importantly, if you take a look, imagine the socket as a ball. What you want to do is you want to put a dot in the middle of the ball, okay? Then you look at the edge over here. You draw a line to the edge over here. You draw a straight line. You ask yourself whether the center of the ball is inside the joint or outside the joint. The more inside the joint, the better it is because it's sitting inside there. The more outside the joint it is, the more loose it is. So that is a very, very rough gauge of looking at hips, which is also why this x-ray certainly will be taken under anesthesia. Okay, so as you can see, the positioning on the x-rays is quite specific. So the doggy has a lie on his back with the leg sort of folded in as close as possible, as straight as possible, then you take an x-ray. Only by doing x-rays like this, then we can interpret things like that. Because if not, a lot of x-rays, as you can imagine, this is the picture that we're used to see. If you take it another angle, certainly you can get different results. That is why it's so important for your vet to say that, okay, it's different from, say, if you're going to x-ray the foot or the elbow, you may not need a full-on anesthetic because the placement is not as important. Whereas for hip x-rays, usually your vet will probably sort of, certainly for myself, I'll be recommending a full anesthetic because under sedation we have tried. The dog is just way too awake and it causes more stress. The dog is trying to get up, it doesn't like the position to be done, and you're trying to take a good x-ray, and the more you delay, the longer it is on the table and things like that. So you might as well have a quick anesthetic, get the right angle, take a picture, and wake the dog up, so to speak. So that is why it needs to be full anesthetic, because of the specific location that needs to be at. Yeah? Okay, so looking at stifles. So basically, if you can take a look over here, normal joint, the normal knee joint. So just to orientate, this is the big thigh going up to the hip. And this is the sort of the tibia fibula going down to the foot. And this is what we're looking at, okay? So a few different points to look at. Same again, angles over here, quite nice and smooth, no fluffiness, okay? There is a fat pad over here. Okay, so as I said before, a bone is white, air is black, okay? Anything else is grey in between. For fats, okay, they're not very good at picking up x-rays, so they're usually quite black, okay? So the fat pad is here. So what you're looking for is a nice fat pad, a nice triangle over here that's nice and black, okay? In contrast, let's take a look at this arthritic knee. You can see over here there's no blackness, it's all white. That means inflammation, okay? So the absence of this fat pad is telling me this joint is inflamed, okay? And you can see the new bone formation behind here as well. It's just not as neat. Look at this sharp hook. Look at this extra hook over here. Whereas look at this nice smooth round. So there's extra bone. So there's sort of signs of arthritis, osteophytes forming, new bone formation forming. And so this is what we're talking about. So whenever we see like this, and this is what we call a stifle effusion, or very fancy term was saying a swollen stifle, a swollen knee, okay, inflammation of the joint, arthritis of the knee over here. Whenever we see things like this compared to a nice black one, okay, another thing that we do is to test. We move the knee, okay, to see whether it actually moves or not. And usually what happens is that the cruciate ligaments, okay, there are two of them, okay, the front and the back, should hold the knee in place, okay, and that stops it from moving around. If you can actually move if I can actually move the knee under sedation, it means that the cruciate ligament is probably damaged. So usually what I'll say is that if you have a lame back leg, feeling it, and I can feel a swollen stifle, I take x-rays and I see something like this, okay, whereby it's inflammation over here, and I can move the knee, 9 out of 10 is a cranial cruciate ligament rupture, either partial or complete. So that is how we sort of diagnose CCL ruptures or cranial cruciate ligament ruptures. Just to throw in a slide, just because we can. So metacarpi, so like I said, it's the equivalent of fingers and toes. Okay, so this is a nice one. You can see, oops. So you can see nice bones, straightforward, nice gaps in between. Okay, whereas it's the arthritic one, whereby you can see, in between you can see nice gaps. It's all just inflamed. So this is what we call arthritis in the sort of carpis, whereby the dogs, they're just very tender, putting the foot down. And the problem with arthritis is that every time you move a joint, it's painful. The best thing, without sounding random, the best thing for arthritis is don't move. But you can't do that. So that is why we talk about, you have to move them gradually and with aid of medication or physiotherapy, hydrotherapy, and things. We should come to that in a bit. But fundamentally, for arthritic joints, it's painful when you move. We all know that. Okay? And that's what we're talking about.